Welcome to Minding Men. I'm your host, Brian Pollack. This is our first show. We wish today we could be at Mainline Network's home studio in Radnor and Wayne. Unfortunately, due to the quarantine and COVID 19, we have decided to do this in our own homes. So I'll be coming to you today from actually my basement. And we do hope that you stay with us for the next half hour as we speak about some really important issues. So, what is Minding Men? It's actually a show that talks about men, mental health, anxiety, and how this all kind of comes about in a way for all the guys in our lives. This affects our families, women, children, and of course, our friends. And this is probably the first time we'll be able to actually get to some of the nitty gritties, as well as some of the underlying causes and values that maybe men don't talk about. So, today for our inaugural show, I am inviting and have with us Dr. Dan Saland. Dan is a psychologist who owns his own therapy practice in New Jersey, and he focuses explicitly on men and mental health. He received his PhD, and when he did that, he actually did his dissertation on cancer with adolescents with cancer, as well as the intersection of masculinity norms. And he then further went on to work at a major university in which he worked closely with fraternities and athletes and sports programs to help understand the nuances of what's happening mental health wise with our young men. Dr. Saland, thank you for joining us. I'm really excited and honored that you joined us today.
Thank you so much, Brian. Good morning. I really appreciate you inviting me on your first show, the inaugural show. It's a real pleasure to be here. The front half of my career thus far has really been about man and masculinity. And for the last 10 years, as you said, I've had a private practice here out in northern New Jersey in Livingston, where I do meet with girls and women, but I meet a lot with boys and men, mostly adolescent boys, young men, college men, and adult men. And it's more of a general practice. I have work with all across the spectrum in terms of what men or what people need.
Absolutely. And
Thank you.
of course, I'm so happy you're here, and I'm so glad you pointed out you also work with women. That is extremely important. As you and I were talking and setting up this show, we talked a lot about COVID 19, what's happening to all of us as we are quarantined. And some of the main themes that you had pointed out were actually different articles as well as different kind of waves of information coming through about men. Can you help us understand what you're finding in your research?
Sure. It's really interesting. Some some news is starting to surface. NPR had an article on Friday, just this past Friday, about sort of this gender breakdown that we're seeing with coronavirus COVID-19 cases. Um, that men are disproportionately sort of outpacing women in terms of diagnoses as well as mortality rate. Um, uh, Men are sort of less likely to go and get tested if they're feeling sick. And then there's for other reasons, biological reasons, as well as psychological, emotional reasons, which I'm sure we're going to get into of reasons why. But for example, the NPR article, or not the NPR article, there's another article um, said that the cases in Italy that let's see, about 28% of the deaths are female and 72% are male.
Wow.
Such a disproportionate amount. Um,
May
Men
I
are
ask?
dying at a more, a much higher rate, almost twice as likely to die from this.
May I ask, is there something underlying with men, particularly that the reason it's a higher mortality rate? Do you think it has all to do with biology, or is there something about men asking for help earlier or later on? What does there a cross section there?
Sure. Well, I think right now it sort of all depends. I think we're aggressively trying to figure out COVID-19 on all fronts. But why is this happening to men? And some of this early articles or early research or professionals talking about it are suggesting yes, biology plays a role, hormones and many other different things. Our biologies are different between men and women.
Mm.
Um, but we're also looking at the social side and the psychological side of what it perhaps what it means to be a man. That's leading to these terrible outcomes. And you had mentioned one has to do with help seeking. And I had said that men are less likely to go get help if they feel that something hurts them or they're in pain. Um, so that's a problem for men to go and get help. For example, and there's also many other unhealthy behaviors, if you will, or beliefs that men carry uh, that also may play a role too.
Great. So, help seeking being one of the things you're talking about, I wonder, you are saying that there's certain other elements. A lot of times what I have found with working with a lot of men and particularly in this crisis as I work with people in my own therapy practice is this idea of having to hold on to being a man, that there are certain norms, seems like there's a script, there's some kind of level of everyday coping and getting through that they seem to really be prescribing to. Can you help? You seem to allude to that. Can you help us understand what
Yeah,
that is a little?
actually, let me share a little story that happened on Saturday. So I go to the bank, gloves and mask and all, and I'm waiting outside the ATM machine, and there's somebody that I recognize, and he's using the machine. And as he opens the door and we sort of awkwardly keep our distance, we recognize one another and we start to kind of catch up from a distance how we're both doing with this pandemic crisis that's happening. And after we, of course, talk about work, right? Because men, which is another sort of thing that we pay closely attention to, is our careers and making money and those sort of an aspect of masculinity. Masculinity, we talk about work and then I say something about how I've been all over the place with my emotion and my anxiety. Um, it's been a roller coaster uh, through this pandemic. So he says, well, I got to stay strong. Got to stay strong during the day for my kids and my wife. But at night is when I crumble and I drink. And it made me
Wow.
think about our talk today. And I walked away from that experience. So here I am. I opened up. I told him that I've been a mess at times through this. But he said, no, 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 I got to stay strong for my kids
Mm,
and my family. But I think we have to question what that means. Is that really being strong? Do men generally suppress their feelings and their pain to stay strong? Something to think. I think we
uh,
have to question.
that's so interesting and heartbreaking at the same time. When you're saying that he's holding strong, and or he said actually he was holding strong, as a person who understands what feels like maybe underlying intentions or the need for survival, what scripts of being a man do you think he's holding on to in that moment?
So for the past maybe 30, 40 years, there's been a lot of research, maybe even more, looking into masculinity, men's lives, the psychology of men, psychology of masculinity. And throughout this work, they've been giving us a framework, an understanding of how traditional masculinity kind of shapes and influences boys and men's lives. So, for example, one thing we're talking about is um, sort of toughness and being strong and silent when facing pressure or adversity in a way that for for many decades we've learned to be strong uh, and to be tough and that's the way of being a boy or a man to get through um, so that's for an example literature really shows uh,
Yeah. Being strong and tough is one of these things that often in the work we do, I often wonder, is there a need for success? or power or control going on. The idea of holding on and no one being able to break that wall so that you can survive in these moments until you crumble at the end of the day. To me, I mean, I don't know about you, it just sounds like something is an overdrive that's dysfunctional. And I wonder and hope that this gentleman is able to communicate and be with his family and everybody together. Do you ever see that this can cause other aspects in a family environment when they're going through something like this?
Sure. I think it depends on could depend on many factors, but yeah, when men restrict the spectrum of emotional experience, it can lead to some dangerous outcomes: irritability, anger, depression, and the
Mhm.
family feels it. A partner, a spouse, um, family members, children, they feel that from men,
Yeah,
from
absolutely.
their fathers.
Yeah, I wonder too, because of the masculinity ideas and scripts in our current culture, if the families just accept this. It's the guy's edgy. He has to be the breadwinner. He has to hold on. He has to put it all together. And we know this is not what we subscribe to or prescribe to, you and I, right? And it very much can become almost stereotypical. But I wonder how this affects all
Well,
of that.
I want to suggest one of the things that I was hoping to encourage our listeners and as well as you and I to continue to do this. I mean, I still, and we're all works in progress. But one thing is because gender, how we learn how to be a boy, how we learn how to be a man is taught at such an early age, and it's been taught and reinforced for decades that it's kind of invisible. We don't really see it. Um, so something that I always encourage people that I work with, or the fraternity members, or the athletes back in the day, was to put on a lens to gender, because once we do that, once you put on these like gender vision goggles, we really see gender being played out all over the place. Um, Here's another example, if I will.
Please.
I was in a conversation this past week, and this man was asking me what grocery store am I going to, and like how many times have I been to the grocery store? So I said, well, actually, my wife goes to the grocery store, has been a couple times since this, COVID-19 shutdown.
Hmm.
So his reaction to me was, "What? You're sending your wife to the wolves? What are you doing, man? Why you're sending your wife there?"
Yeah,
So it was so interesting. Like his first reaction was to sort of take a hit on my masculinity. Like I think that that's what he was implying, is that I should be the one going to the grocery store in the face of this such threat,
that's right.
and my wife, I should be the protector, with her staying at home safe. I told him that, look, my wife is the one that does the grocery shopping always. She knows where everything is. It would take me like 3 hours to do the grocery shopping. She's able to do it from 40 minutes. So I wanted to share that story as well.
There's a couple of things, thoughts on that. Number one, just to go backwards, what I think is so kind of funny, which is a gender norm that maybe I'm going to point out because I like you and you're a colleague and friend, is the wife shopping a gender norm? Which is like a funny thing. And so when we get done with the show, I'm going to push you to go to the grocery store. You and I are going to have that conversation. I'll get you sanitizer
What
somehow.
if I'm scared to go? Right.
We can talk about that. But even more, if you go back a little bit to what you're talking about, this guy and this reaction, as a guy who understands this and sees these kind of stereotypical pressures, what do you say to something like that? What can we as guys, or even the loved ones who aren't gendered as males, how do we respond to such a thing? Because I think a lot of times we end up shutting off or shutting down or just go, yep, okay, fine, and we put our hands in. Any
Yeah.
suggestions?
Sometimes I have to decide whether I'm going to say something or not. In that interaction, I just kind of played off the humor and just explained myself. And other times I will sort of do some education, maybe confront the individual. Here's another example, if it's okay. Um, I had someone telling me about work and frustrated about their boss who sent them an email or text about how to handle a certain situation. And in
mm,
the conversation, this man says to me, as he's upset about his boss, I wish he would just man up and tell me in person. So I took the opportunity and I said, "That's interesting. What does it have to do with his manhood? What do you think?" And he was like, "Well, I guess it has nothing to do with that, but I'm just saying." And I said, "Well, maybe it's more about being professional." And he's like, "Yeah, yeah, that's better. It's not about being a man." I
uh,
said, "Yeah, it's about being a professional, coming to you and talking to you in person." So it's interesting how many people use gender to justify behavior or to criticize someone's behavior. Uh, you know,
100%. And in your practice and in some of the clinical aspects in the time we have to talk, I just want to make sure we kind of recognize that you do this every day, that you're talking to people about how to understand these lenses and these scripts. And in a time of COVID-19 and quarantine and everyone trying to make sense of this, any suggestions of how we as guys can possibly ease some of that edge or ease that tension around these lenses and scripts?
yeah, sure. So, two, but we've already talked about help seeking. And the other one, well, I guess we did mention it, was the restricting of emotion. And these are
Mm,
two aspects that I would, I guess, continue to reinforce or sort of try to bring more attention to for men during this period of time. Like my friend, the acquaintance who has to stay strong in his definition of what that means, but at night can sort of fall apart, but he's in isolation at night. I mean, that's what it sounded like.
mm,
It created this picture for me that he's by himself at night,
yeah.
and faced with the demons. So the first thing about help seeking, uh, we have to get help. We have to say something to our friends and our family that something hurts us, that something's in pain, or something doesn't feel right. Maybe I should get this checked out. For a
Mhm.
long time, boys and men here, suck it up, walk it off, take it like a man. I mean, how many times have you sort of hit by a baseball as a child and walk it off, Brian, right?
Absolutely.
So
Yeah.
when we hear these messages throughout our upbringing, when we're adults, we got to get to work. We got to do our job, whatever that might be, and we may not have time to go and get things checked out, but we have to. Uh,
How do we stop ourselves from falling into this? I did exactly this exact thing with my young boy. I have a 6 year old just this weekend. And it's not because I am trying to push him to be a man, it's because it's been programmed in me. Acculturated. I've learned this since I was a kid, right? And we're playing baseball and he falls and he trips. And I look at him and I go, you know what? Shake it off. You got this. Let's go. Would you say that's appropriate? What do you think?
yeah, I think it all depends. Again, the psychology, right? It all depends. Um, I want to show you a piece about. I do think it's okay. I think you have to be mindful of um, what's the message that you're trying to send to your son in that scenario, and then also kind of to be seeing how it plays out. Um, and if he starts to ascribe to these scripts of masculinity that are troublesome to you, I would find opportunities to correct it or have him think about things differently. But I wanted to show you had brought up my dissertation before, where I worked with adolescent males with cancer, and of course I went in thinking that something like restricting emotion wouldn't help an adolescent boy who gets diagnosed with cancer. Um, that it would be important for a boy to be talking about what's happening to him as he experiences such tremendous change and vulnerability.
Mm,
But as I was interviewing oncologists for my project, I started to see that masculinity is being used to help boys get through. And this can be said for any type of adversity. Maybe on some level, like the guy that I
yeah.
ran into, is using strength to get through, to show his family that we can endure this very painful and scary time. So for the boys with cancer, one of the oncologists would say to boys, "Come on, be a man," and they would feel a little less anxious to get a shot for treatment. So it, I don't think it's all bad, but of course, as a psychologist, as a clinician, I am looking for these ways that it hurts boys and men.
I almost wonder if we can take that word, be a man, and say, it's going to hurt, but it's going to be okay. Or you can be strong and get through this. Or it's okay to be afraid, you know? And normalize those experiences so that when these things happen, we can prescribe to that idea of strength. We can prescribe to the idea that it is sometimes good to be masculine. We don't want to emasculate people. That's not what we're after here at all. Because look, there's femininity, and then there's masculinity, and there's a ton in between as we're learning through the ideas of genders. And with that said, it is an experience here where I think we just almost have to find a way to say the same thing, but maybe in a way that empowers versus tattoos them as something.
Yeah. I also think it's okay for men to model uh, a wider array of being a man. There's a concept called masculinities, and that's pluralizing what it means to be a man. That there aren't a certain amount of behaviors and thoughts that boys and men have to be in. This is this man box, right? That puts boys into a box. Anything outside of that box is not acceptable.
Yeah.
When we pluralize it, right there, masculinity is infinite. It could be any way to be a boy and a man. So I like to model to my son. I have a son. I like to model vulnerability. I've showed him that I've been scared during this time, and I've also showed him that I can endure and be very strong too.
Mm.
Um, but I think this concept that have you ever seen your father cry? Maybe I saw my dad cry once or twice, I think, in my life, and sometimes get a little tearful. Well, I'm proud that my son has seen me cry many times.
That's amazing. That's so awesome. And that's something we all hope we can offer who do this type of work and really care about being a good role model and mentor. If we brought this whole conversation all the way back to that gentleman at the bank, okay? And we talk about the inability to show and role model, and he has all these masculinity boxes he's checking or lives within. I almost wonder, in the moment, one thing we didn't talk about is when he kind of said to you, when you kind of said to him, I'm struggling here and there, but I'm getting through it and all this other stuff. He didn't ask any further questions. He wasn't able to almost communicate or connect as a guy relating to you because it could have made him possibly vulnerable, or timing wise he's on a schedule or something like that. And I almost wonder if he allows that type of communication with his own children, he might be able to do exactly what you're saying.
Yeah,
You
maybe.
know, when you're stuck in that box, you don't have time to do these things, to be present, to be with people, to get outside that box per se. Um, this is wonderful. I appreciate it. Dan, if people wanted to know more about you, where do they go?
Sure. Yeah, I have a website, www.drsaland, my last name. So drsaland.com. And you can also send me an email, ds@drsaland.com. And I'm in Livingston, New Jersey, my private practice.
That's amazing. And so, Sir Dr. Saland, if I were to say you have one last statement you wanted to make and let everyone know about getting through this, trying to make sense of everything that's going on in our lives currently, and include the idea of gender scripts and norms, what would you say?
Yeah. Well, I think it's very manly to know thyself and to know what one needs.
Yeah.
Um, there's sort of two types of men. One, they have a similar problem, and one goes and gets help for it, and one that doesn't. I think the one that goes and gets help for the problem is the stronger person in that scenario. Um, so I think it's actually very manly to take care of your own needs and take care of the needs that are around you, and that's really looking within. Open up. That's what I would say. Whether
That's
talk
awesome.
about it, write about it, sing about it, we have to have an outlet. It's such a scary time.
Yeah, I couldn't agree more, and we cannot thank you enough for being the first guest on Minding Men. I cannot be honored anymore. You are awesome, and I know your abilities, and they've been nothing but fantastic. And I only hope the best for you as we move along here.
Brian, likewise, I am so honored to be your first guest of your show. Thank you so much. It's a
Yeah,
pleasure to be here today.
you got it. And everybody who has listened, thank you for joining us on Mainline Network. We're really hoping this is going to be a place to have some really great discussions about mental health in men and coping and getting through everything that we're going through. Um, have a wonderful, safe experience, and we're here. And please check in on Mainline Network as they're offering wonderful shows for all of us to connect with. Thank you and be safe out there.